Hey, back again. Now we're going to talk about movement, and we might include some sports activities in that. So
they talk about gait. Gait, really, it should be not 2 legs, gait, but gait, and that's just the type of walking and what they look like. And so there's a walk, which I know it doesn't fit because of 2 legs, but walk. And then they have these 2 types of walking that's really not good for a dog, but it's just like fast walking. So we have, it's amble, which we just do amble, and pace. So it just looks like this like kind of fast, uncomfortable walk with the A or the P. Then you have trot. It should look comfortable and like that. And then like a gallop, or like gallop is really like the fast one. So they mostly talk about trot, especially for your class of therapy. They will be focused on trot. If they use the words like static, it really means standing, and same with stance, standing, stance. And then there's a difference between sit and down and stand. Like when you tell a dog to sit, really their front legs are still kind of up. Down is when they go down.
almost like they're laying.
Down.
Like they're laying, but their paws are sort of out.
Yeah.
It's sort of a trick that they teach you. Well, they're assessing different muscles, so that's part of why the different movements of the body forward versus the back. So
They do a lot of like weight bearing, see which paw has weight bearing on it. For posture, it's just shape with, make sure you yourself like stand up straight posture.
We sometimes, do this or do this, or what if we know what kind of posture we're talking about.
Like they have 2 specific types of posture that are really like something that's important to note, and it's called lordosis, which is when your back is arched, super arched, and then kyphosis, where your back is hunched.
Lordosis and kyphosis.
It just helps to know.
Lordosis, kyphosis. And I'm sure you know those ones. And I think you blogged about those 2 recently. You had seen one. I wouldn't be surprised if you see that in ortho too coming up. So it's interesting. Some of these concepts now will apply to the ortho surgery rotation that's happening soon. And then what's
Eccentric and concentric.
Oh,
so this is
isometric. Isometric too.
So for muscle contractions, we're really getting into kind of like the physics of how like muscles even like move and work.
The vectors and things.
Yeah, it's been intense. But so there's isometric, where it just means your muscle contraction doesn't cause a bone to move. So it'd be like if you just were standing there and had a weight put in your hand, your elbow doesn't move, but your muscles are working now that you have a weight. So that's isometric. And then you have eccentric, is when your muscles are going against gravity. I honestly, I don't even know, but it's eccentric and concentric.
The eccentric is the one where they start to flex, right? They start to contract the muscle.
I kind of think it's the opposite.
Or
I think
is the eccentric the one where
if they have to move something down slowly, but they want to move it fast, that would be going against gravity, right?
Yeah. So
Eccentric.
is the
Point is that we've used many times eccentric, concentric, isometric. So she knows this little like circular motion means that.
Plus, usually the slide is talking about whatever we're talking about. So whatever hand shape we're using this. And then some sports to include. A very frequent one they use in the dog world is called coursing. No, I was going to actually say agility.
Yeah.
Agility. And that is going through obstacle courses. So we started signing like that for agility because they're like going up and down and around, all these things. And coursing. Oh, coursing.
Yeah, these are ones we like ask the client specifically about, because right now we're in the sports class, so they're more
that
often.
one? Is that
Coursing is
balls
like, I
thing?
think it's when you have like a metal rabbit or something on the side on a track, and the dogs all like chase after it around and around. But
Is that
coursing.
different than luring? A whole bunch of
There's
sports.
so
And
many
you have
dog
access to the
sports. Oh my
sports
gosh.
one too, but
Um,
honestly the sports ones,
Agility.
most of them, we're just gonna highlight the ones where you're like, you hear and you're like, what's that? I mean, you can figure out hunting and that kind of thing. So, but one really interesting one, it sounds like confirmation. Well, it is confirmation, but it's not signing confirmation because it means more. What are we signing?
Confirmation.
Confirmation.
It's like the part of the dog show where they like assess how the dog is standing and if its head and its hair and everything looks perfect, and wow, that's a beautiful show dog. So confirmation.
It's like
is
all
how
the
they're
points
standing.
on his body. Like, can he stand up perfectly? Does he have anything out of alignment?
Straight,
These
yeah.
confirmation.
And then an underwater treadmill, we sign like water treadmill.
Guys, on this treadmill.
But you'll see it abbreviated underwater treadmill often too.
All right, we're going to come back and we're going to talk about stuff that they would do on their interview with their clients and their patients. So clients are the person, the clients, and then the patients are the dog. So we'll be back soon.